Yeah, they doped you up pretty good, man.
So does anyone have any guesses as to what medication they used to dope him up on? Well, if you guessed the category benzodiazepines, or more specifically guessed Ativan, then you are correct. Ativan's generic name is lorazepam. The brand name is Ativan, as I just said, and street names include Candy, Downers, Goofballs, Heavenly Blues. I've also heard Sleeping Pills, Tranks, and Ativan comes in 3 different marketed forms. So it comes in an oral solution, an oral tablet, and an injection solution. And here are 4 pictures demonstrating Ativan in its 4 different marketed forms. So in the upper left-hand corner is Ativan as an oral solution. The bottom left-hand corner is Ativan as an oral tablet, and it's like a little circular white tablet. And if you look across the screen, on the bottom right-hand corner, there's Ativan as an oral tablet once again, but this oral tablet is in the shape of an A. And then in the upper right-hand corner is Ativan as an injection. Question 1. Which of the following is not a street name for Ativan? A. Candy, B. Heavenly Blues, C. Pet Bills, or D. Goofballs? And I'll give you a moment to decide. If you said C. Pet Pills, then you are correct. Ativan is a benzodiazepine medication that was developed by D.J. Richards and introduced into market in 1977. Benzodiazepines work by blocking the GABA receptors to slow hyperactive mental processes, such as anxiety, for example. And since it was introduced into market in 1977, Ativan is legal and FDA approved, but it's FDA approved for short-term relief of maximum of 4 months for anxiety-associated insomnia, but it also can be used to produce sedation in patients who are overstimulated and are like having a difficult time calming down. Question 2. Ativan blocks blank receptors to slow hyperactive mental processes. A. Dopamine receptors, B. GABA receptors, C. Serotonin receptors, or D. Acetylcholine receptors. And I'll give you a moment to decide. The correct answer for question 2 is B. GABA receptors. For question number 3, true or false, Ativan is approved for short-term relief of anxiety symptoms. The answer to question number 3 is true. And reasons why people still consume this drug. Ativan is commonly prescribed for anxiety, insomnia, and seizures. When taken in extremely high doses, Ativan can produce a feeling of euphoria, but the drug was designed overall to relax or sedate you. And people with a history of drug or alcohol abuse, or people with a history of untreated mental health disorders, are more likely to become addicted to Ativan. And then, let's see, ways that people get Ativan. Well, the number 1 way that people most often get Ativan is through prescriptions and being prescribed by their doctor, and then that's just typically how they end up becoming a dependent and then addicted to Ativan. But if that's not the case, then they also can obtain Ativan through friends or family who have easy access to the drug and potentially abuse it that way. Or if they have reached this level of desperateness, they might even reach out to street dealers in order to obtain the drug. And this is more risky because, people can lie and deceive you in the streets, and they can tell you it's one thing when really it's another. And that could be why you end up overdosing on something. So question number 4. People typically obtain Ativan through which of the following? A. Online, B. Street dealers, C. Prescription, or D. Friends and family. And people typically obtain Ativan through prescriptions. So some short-term effects of Ativan include a reduced sense of anxiety, insomnia, and tension. Like I said previously, especially in high doses, euphoria can be reached, a sense of calm, muscle relaxation, and drowsiness. And then long-term effects include sedation, disorientation, confusion, financial difficulties, divorce, seizures, also family difficulties, including the potential for child or spousal abuse. And then question number 5, which of the following is not a short-term effect of Ativan? A sense of calm, B, disorientation, C, drowsiness, or D, muscle relaxation? And the answer to number 5 is B, disorientation. For question number 6, long-term effects of Ativan include all of the following except A, sedation, B, confusion, C, euphoria, or D, financial difficulties. And the answer to question number 6 is C, euphoria. So the prevalence of benzodiazepines. More than 30% of opioid overdoses also included benzodiazepines. And between 1996 and 2013, the number of adults who filled a benzodiazepine prescription increased by 67%. In 2015, 23% of people who died of an opioid overdose also tested positive for benzodiazepines. And this happened because these drugs are often co-prescribed, making these patients 10 times more likely to overdose compared to those just prescribed opioids, for example, according to this cohort study that I found conducted in North Carolina. And the percentage of persons being prescribed both opioids and benzodiazepines rose to 17% in 2013 from 9% in 2001. Question number 7. More than 40% of methamphetamine overdoses also involve benzodiazepine. True or false? And if you chose false, then you are correct. Question number 8. In 2015, blank percent of people who died of an opioid overdose also tested positive for benzodiazepines. A, 30%, B, 25%, C, 23%, or D, 20%. And the answer to question number 8 is C, 23%. So this is just a graph that is depicting the past year prescription benzodiazepine misuse among people aged 12 or older. And if you focus on the blue line, that's ages 18 to 25, which is where the benzodiazepine misuse typically occurs and is most prevalent, which this is also the age range of like experimentation and college and just kind of a stressful time to begin with, and might be one of the reasons I think that people would be more willing to experiment with it during this time in their life. But if you look, there's still been a decrease compared to 2017. In 2017, the number of people misusing benzodiazepine was 5.3%, and if you look at 2018, it's now 4.5%, so at least it's going down some. That's definitely better than it going up. And then the effects that Ativan has on family, community, and society. In families, short-term Ativan can be beneficial at combating anxiety, insomnia, seizures, etc., but people do just have to know and understand that there is the potential for addiction, and that being on it for longer than 4 months is when the increase for addiction really does begin to occur. And long term, as I just said, it can lead to dependence and addiction. For communities and society, there's going to be lost productivity because of those who are addicted to Ativan, potential unemployment, and then the potential for violence or abuse, especially when they're going through withdrawal symptoms. They just become more aggressive, more agitated because their body doesn't have something that it's become so dependent and reliant on. And then recovery options for benzodiazepine addiction. Addiction Allies is an option around here, as well as Pathways Addiction and Recovery Services. And here are my references. And yeah, thank you so much for watching.